uploaded a video on what a chemo room looks like, or at least mine does. I've seen multiple people with cancer that I've gone with them, and that's pretty much what their room looked like too. I'm going to do a real quick update here on, where this thing started, how I found out. Back in October, I had my annual physical at my VA hospital, and anyhow, it showed that I had some issues, and they thought it was gallstones. So they said, okay, you seem to be okay, we're going to monitor that, and why don't you set up an appointment, come back in 30 days. Okay, so 2 days later I started my urine was color of Coca-Cola, and my stool was almost white. So I sent them an email through the system, which not realizing it took several days for them to get. Well, I didn't hear, so I called, told them what was going on, and they told me to come in the next day, which I did. They looked at it, they tested, but they knew that there was an indication, not only gallstone, but because of the numbers, that they figured, okay, there's something going on with the pancreas. And they thought a gallstone had gone in and blocked the thing to the pancreas, and the pancreas was backing up. So they immediately 911 me to a local outside hospital, where they brought me in and did some tests, and decided that they were going to go in with a procedure to where they take a scope and go in and look at this thing. And so they did that. And when they were in there, they took a couple of biopsies and came out and said, well, it's blocked, but it doesn't look like cancer. It looks like it's just inflamed growth. There's a little growth there, but it's inflamed. So we don't think it's cancer. So okay, so now, when I first came in, some of the people there said, cancer, pancreatic, 3 months or less, probably, which was a deadly shock to me and my family. But anyhow, now they're telling me it's not cancer, so my family's, yahoo, yay, Dad's not going to die. Well, then, the next day, after the biopsies had been sent out, they came in, and they went in to put a stent in to unblock the pancreas so it could drain out, so that they could give me stuff to treat that. Well, so they did that. Now the next day, the 2 original biopsies came back, and they came in and said, hey, great news. First one came back, you don't have cancer. And so that's awesome. Second one came back, and they said, well, it looks like it might be cancer. So, okay, so now I'm there, and they're still doing whatever they do. Now, the next day, the second biopsies from when they did the stent came back, and they came in and said, well, you definitely do have cancer. So, that's what's going on there. And, let's see. They sent me home. They did some other stuff in between. Again, it's the day after chemo, so my thought process is a little wandering. Sent me home. I was home 2 days when my little 4-year-old granddaughter, who normally comes down around 10:30 on weekends to ask Papa for a juice cup, because she's up with Grandma in the master bedroom, and I don't do stairs. Anyhow, she came down early that day, I guess around 7 o'clock. I don't remember, because she found me laying on the floor in my bathroom, just a mess with urine, etc., just flipping around delirious. She got Grandma. They 911 me, got me down to another outside hospital outside the VA, where they determined that I had something called MRSA. I forgot what it means, but it's not fun, and it can kill you it's not a good thing, okay? So now they're trying to figure out what's causing this MRSA. And of course, I'm still delirious and whatever, so weak I couldn't even move my head. They found out and determined that the port that had been put in was infected. I guess I kind of skipped. I went from the hospital, the first hospital, I came back, I went and got a chemo treatment, okay, got sent home, and then 2 days after that, I ended up getting 911. Okay, so sorry for the backup, but so now I've gone through one hospital, told me I had cancer. The next place was a cancer center, Mayo Clinic and the Cancer Center. First Mayo, and then they set me up with a cancer center in the cities. And then from there, 911 again. And they decided that the port was infected. They had to get rid of that. So they did, and then they started an antibiotic to treat the infection of MRSA. Okay, so good to go on that. Now we're there. It's 18 days or so, because that's how the people who do infections and that's how long it takes. You got to go at least 18 straight days to try and kill this stuff. But it also, they put me on steroids, prednisone, and they put me on. Turns out I am now a type 1 diabetic because of these treatments and that. So I'm home for 2 days again, and I get 911, this time back to a different VA medical facility that's closer to my home. That's when they decided or determined that I had something called DRESS. I always, for some reason, I said red man's dress. Anyhow, DRESS is, oh God, it's awful. And eventually they said I probably had one of the worst cases they've ever seen. What it is when I was a kid and we got sunburned, we'd get little tiny blisters on our body. And of course, they'd be small or whatever, and someone would rub them and then they'd dry up or that. Well, anyhow, this DRESS causes blisters over your entire body. Now, I have some photos that I took of some of that, and I really don't know how to get them uploaded yet. I'm still trying to learn that stuff. But it's nasty. It started with just a small spot, and it spread over my entire body, and I mean entire body. Your body gets all bloated up. My face was, a real mess. My body was a mess. I was covered from my face all the way down to my toes. My feet got so swollen I couldn't even hardly put the hospital socks on. And you itch like crazy. They constantly give you stuff to help with the itch, the pain, and multiple rub-downs with some kind of magic lotion 3 times a day to try and get this under control. Anyhow, that took another 20 days to get rid of that, or get it down, which there were issues within there on how to get the procedures, what to do, who could do it, who could get permission, where we're supposed to stay, multiple issues, including when they wanted to release me. Anyhow, I got my dermatologists that were assigning stuff and kept me there trying to get this stuff down well enough to be sent home. And that was, again, juggling the steroids and insulin. And I started with, 80 milligrams of prednisone a day. And I don't know what that means other than it's 80. Then every 2 weeks it went down by 2. I'm down now to only 30. So I did 80, 70, 60, 50. I missed, from my first chemo, I missed almost 3 months of chemo treatment, which with pancreatic cancer is not a good thing, because if they find it early, they want to get it out early. And so that wasn't a good thing. But anyhow, so they finally got me treatment for that. And so I'm back home again now. I'm supposed to go see my dermatologist again at that medical facility. And I forgot to mention when I went to Mayo and this cancer center, but in between there I did that too, and Mayo's when they got me on chemo. Anyhow, now I'm back home, And I'm going, a week later I go down to my dermatologist to have them check because I still have this dress, all these blisters, only it's manageable. I mean, I've got them on my stomach and my waist, down around my groin, things that I can put the lotion on myself and not be stuck in that hospital, because I was there like, oh God, about 50 days I was in the hospital beds with, and then after the chemo, one thing I'll mention is, for me, my veins, although they look like, hey, this is going to be an easy pick, not, they collapse. At one point in time, they had to give me pain pills because I had so many pics of people trying to get blood drawn in me that I couldn't even lay my arms down. So eventually I just said, okay, the last time I had someone try and draw blood, she got 2 shots and I said, nope, you're done. Then she brought in someone else, she had 2 shots, you're done. Then they brought in another person, I only gave her 1. I said, that's it. You get in someone from somewhere, that's all they do is draw blood, because I'm not going through this. So what they did is they actually ended up getting some guy, well, it varied between men and women, but what they did is they used this ultrasound thing to be able to make sure they were getting the needle in right for the IV. And the IVs typically lasted me like 2 days, and then they had to replace them again. And at several points I had IVs in both arms for different draws. So chemo does affect some people like that. It affected me that way. So now I'm out. I'm back to my dermatologist to see how things are going. I took my blood sugar count when I was here at home, and it was relative 200, 250, which for me was okay. Anyhow, I got down there, it was 700, and 500 is like stroke territory. So immediately the emergency room, where I laid on my back, throwing up all over myself for a while they gave me some kind of super medicine to bring this down. Didn't get it down until later at night. My wife had gone home because we live a ways, and they were going to keep me, which they did. So now they moved me to a different section of the hospital after they had me somewhat stabilized. And so I got in that side of the hospital, and here's what happens. When you go in, if you haven't been there, most hospitals do this that I've been in 4 outside and 2 VAs. They discontinue all your meds until the next morning, when the doctors can look at things and try and decide what to put you on. Well, for me, that was the worst thing in the world, because I've been on meds for years, and of course they didn't have access to them, so they didn't know that. So that caused some problems trying to get that resolved, because without some of those meds, I started going into withdrawal. Anyhow, I see my time is about up here for this one, and so I'm just going to cut this one here now, and I don't know if I'll come back later today, but maybe tomorrow, and start up again with the meds. That's something you should be aware of. Okay, well, I'm upright still, and other than that, you guys, whoever you are, guys or girls, I'm not supposed to say girls, you people, have a good day.